What is the color of implantation bleeding?
Hello there. Today, we are going to talk about a topic that is often a source of confusion, especially among those trying to conceive, implantation bleeding. Specifically, we will focus on what color implantation bleeding is. This is a common question, as it helps to distinguish implantation bleeding from a regular menstrual period.
What is implantation bleeding?
Implantation bleeding is a form of spotting or light bleeding that can occur when a fertilized egg, or embryo, attaches to the lining of the uterus. This usually happens around the time of your expected period, making it easy to mistake for the start of a menstrual cycle. However, there are certain characteristics that help to differentiate it from regular menstrual bleeding.
What color is implantation bleeding?
Implantation bleeding typically varies from light pink to dark brown. The color can provide some indication of where in your cycle the bleeding is occurring. The pinkish color often indicates fresh blood, whereas a brownish color usually suggests that the blood is older. In other words, the blood has taken some time to exit the body and has oxidized, which causes it to turn brown. It's important to note that implantation bleeding is typically lighter in flow than a regular period. It's usually a light spotting that may be noticed when you wipe, and it typically lasts for a few hours to a few days, not a full menstrual period's length.
How to differentiate between implantation bleeding and a regular period?
There are a few key differences to consider when trying to determine if the bleeding you're experiencing is due to implantation or a regular menstrual cycle. 1. Color. As mentioned earlier, implantation bleeding is usually a light pink to dark brown color, whereas menstrual blood tends to be bright to dark red. 2. Flow. Implantation bleeding is typically very light spotting, not a flow like what you would experience during a normal menstrual period. 3. Duration. Implantation bleeding usually lasts a few hours to a few days, whereas a menstrual period generally lasts around 4 to 7 days. 4. Cramping. While some women might experience slight cramping with implantation bleeding, it's typically less intense than the cramps associated with a menstrual period. 5. Timing. Implantation bleeding usually happens about a week before you expect your period, often around 9 to 12 days post-ovulation. Understanding the color and other characteristics of implantation bleeding can be an important part of recognizing early pregnancy signs. But remember, everyone's body is different, and these are just general guidelines. If you have any concerns or doubts, it's always best to consult a healthcare professional. Thanks for watching, and we hope this information has been helpful.